We're learning about something that is in high demand. It's called convalescent blood plasma. It's a promising therapy that could make a difference to the nation's sickest COVID-19 patients. But it's in dangerously short supply, with no end in sight for this raging pandemic and healthcare workers at their breaking point.
I've heard patients talk about it, but I never experienced it till that moment.
Georgia urgent care nurse Amanda Salt has worked tirelessly through the pandemic. But this past summer, the frontline hero became a patient battling the coronavirus itself.
You have a very overwhelming sense of doom.
Struggling to breathe, Amanda was hospitalized and declining fast. She says she doesn't remember much, but this snapshot taken by her nurse.
She says, we're going to take a selfie because we're going to remember this moment because this moment's going to save your life. And it did.
Amanda received convalescent plasma from a person who recovered from COVID. The antibodies from the plasma can help boost a patient's immune system. But Dr. Pampi Young with the American Red Cross says time is of the essence.
So we're seeing very new studies come out that suggest that the earlier you give it, the better it is.
But Dr. Young says as cases surge nationwide, there's now a dire shortage of convalescent plasma.
This is a disease that has still very few therapeutics. We just simply can't keep up. So we need as many of our recovered COVID-19 patients as possible to roll up their sleeves and come in and donate.
That's what Amanda is doing. She's back at work, already donating her own plasma and encouraging her patients to do the very same. Because this grateful grandmother knows firsthand the gift of life it brings is priceless.
How do you say thank you to that? I could never, ever tell them thank you for giving me a second chance on life.
If you had COVID and would like to help, fully recovered patients can give plasma every 7 days as long as they still have antibodies. And even if you don't have antibodies or have never been infected, the American Red Cross says it is always in need of blood and platelet donations, especially during the pandemic. To learn more, visit www.redcross.org.